My name is Greg Felt, I'm Director of Public Health. This is a short piece on the position statement on COVID as of today, the 8th of September. Three main things to say: what the epidemiology is telling us, the arrangements to manage, and the kind of my take on the hot issues. Things are hotting up. Was expected. We know that incidence is rising across the country. You can look at the weekly epidemiology report from Public Health England. You can see that that's really clear. In Sheffield, it's beginning to hot up. What we've seen over the last couple of weeks is a fluctuating trend. So it goes up, then it goes down, it goes up, it goes down. Generally in a fairly stable pattern. And currently, as of today, we're on the upwards trend of a fluctuation. It might be that that's part of a more generalised upward trend, or it might be just another fluctuation, and I wouldn't like to call that one way or the other. But we do know that one way or the other, the incidence will continue to go up over the period of the autumn. So we've seen over the past 6 or 7 weeks that there's been an increase in cases nationally, a little bit locally, but certainly nationally. The positivity remains quite low, the proportion of people who test positive, principally working age people. There's very little COVID diagnosed at the moment in older people, so principally working age people. That's a trend that's seen nationally, it's seen in all of the regions, it's beginning to be seen in Sheffield as well. So as of today, the incidence is, the 7-day incidence is 25 per 100,000, and as I've said, that's been a fluctuating trend. I think it will go up over the next few days. The reasons for that, I'm reasonably well aware of. There's been a significant outbreak that's being well managed, but that will add numbers to our incidence. Hospital activity is negligible, or almost zero, not quite zero, but almost zero. So there's a tricky point here about people will think this is all over. Hospital activities is zero to negligible because those people who are being diagnosed, have symptoms and have a positive test are generally youngish, generally well-ish. I can almost guarantee that we won't be able to hold that position going into the autumn and winter. It's almost inevitable that we'll start to get into COVID being transmitted to older people, and we've seen what that can do from earlier on in the spring and early summer. So currently, the average age per case has gone down. As I say, that's good news because at the moment we're not seeing many people who are very poorly, but that won't be contained forever. I suspect it will start to see transmission in older people and people with medical vulnerabilities as we get into autumn. So it is not all over. You've heard me say that before, and I'll say it again and again because it is not all over. So some of the core messages need to stand. What we're seeing is shifting geography. We've seen the epidemiology shifted. It's not as concentrated in some parts of town as it once was. The spatial spread is much wider across much wider part of Sheffield. Admittedly, still relatively low numbers. It's a good thing. We expect that will go up. Mostly household clusters, but mostly spread more diffusely across the city. The mean age is lower, as I've said, and the ethnicity has changed actually. A month or so ago, the proportion of people being diagnosed from black and minority ethnic backgrounds was much higher than it is now. Now it's much more ethnically mixed and much more representative of the actual Sheffield population. So that was we did some focused work in that space, and that has had the effect that we thought it might. The key issues remain household clusters, getting on top of those pretty quickly, ensuring that people who develop symptoms get a test and isolate quickly, and that they give up their contacts to NHS Test and Trace, and their contacts isolate, and if contacts obviously become poorly, then they too should get a test. Our strategy remains the same. We keep people safe, we protect the vulnerable, we reopen Sheffield, and we follow government guidance. We have an operational plan, we have the right arrangements in place to keep a track of the surveillance and the epidemiology, the soft intelligence, to quickly manage cases and clusters that will arrive, to put some focus time and energy into contact tracing in communities where we really need to up our contact tracing completeness. So we have the right operational arrangements, and that will continue for the course of the pandemic. Forward look, next 3 months, I think the strategy will remain the strategy: keep people safe, protect the vulnerable, reopen Sheffield, follow government advice. I think there will be a rising tide of infection over the next couple of months. That seems inevitable. It's certainly happening in other parts of the country. University and school impact will probably be substantial. We don't know how substantial, but looking at what's happening in other parts of the world, it's likely to be substantial. We can't not reopen schools, we can't not reopen universities, but we have to be prepared for what might happen as a result. So we will be sticking with the plan. We will be pushing prevention-oriented interventions. We will be pushing testing accessibility and capacity, managing cases and clusters. Shielding is paused at the moment. That may be restarted nationally. That remains to be seen. That will be a national policy decision. Flu will be a big push this year to get flu jabs in those who are eligible for flu jabs. Flu still kills people. What we really want to avoid is a bad flu year and rising tide of COVID-19 infections. So if you're eligible, get a flu jab. Things that are on the horizon, Christmas is coming. It's a big festival. We all like to celebrate at Christmas, bonfire night. There's a few things that are coming which we'll need to think about managing. So it's not all over. We will be responding to this for the next 18 months. We're trying to get on with business as usual. We know we have some work to do around improving the completeness of contact tracing. Testing capacity is stretched at the moment. That's probably a transient issue. So we're very much asking people with symptoms to test, not those who don't have symptoms. We'll all get fatigued. We're a bit bored of this now. I am. So sticking with the programme is really important. There's a few hoaxes around at the moment. The most recent one was that the council would forcibly test and detain your children. It's an absolute hoax. So there'll be a few more of those. That's about where we are. We were living with COVID for the next few years. We think there will be an increase in incidence as we get into autumn. We currently have pretty good arrangements to manage that, but we certainly can't guarantee there will be no more rising incidents.